Hi, my name is Dr. Elisa Marzec, and I am a family medicine physician at St. Rita's Family Medicine in Columbus Grove, Ohio. Today we're going to be talking about hormone changes and the effects that this can have in a woman in the later stages of the middle to late stages of her life. First, I'll start with a few simple definitions. One would be perimenopause. This is described as the stage leading up to menopause, or the actual cessation of your menstrual cycles. Perimenopause usually starts in around age 40 to 50 in women, and typically is about 4 years prior to your final menstrual period. Perimenopause is when we get the symptoms that people most likely complain about. We often, as a family medicine office, hear, "I'm tired," or "I just don't feel well," or "I'm losing my motivation." These are very common symptoms that present in the perimenopause stage. Initially, there is a lengthening of the menstrual cycle, where typically a menstrual cycle goes from 28 to 30 days. In perimenopause, it will start to lengthen to between 40 to 50 days per cycle. Eventually, the menstrual cycles will then fall off altogether or become very erratic and irregular. This is due to a decrease in the estradiol levels, which leads to anovulation from the ovaries. There is also a spike in follicle stimulating hormone, and these two hormones are the main changes in the perimenopausal state. The next definition I would like to say is menopause. Menopause is defined as 12 months without a period, or 12 complete months of amenorrhea. So menopause is not a diagnosis from blood work. Menopause is a clinical diagnosis. Oftentimes we have women come in with symptoms and they say, "I want to know, I need to know if my hormone levels are regular. Can you check all my blood work?" Well, this isn't necessary because the definition is strictly clinical. We go by the symptoms that the patient is having and then sort of track her cycles and go from there. By far the most common symptom in the perimenopausal state is hot flashes. This starts as a heat that starts in your chest and often will rise to your face, and it eventually becomes generalized. People say that they feel like their entire body is on fire, and these periods are typically brief but can be very disturbing. They happen several times a day and oftentimes also at night. These hot flashes at night are known as night sweats, and they can lead to sleep disturbances as well. Sleep disturbances are a big reason why women complain of fatigue during these years. Hot flashes occur in more than 80% of women in the perimenopausal state. Depression is an also major complaint in the perimenopausal state and also postmenopausal. This is likely due to the decrease in estrogen. Although that's a major factor, there can be other factors as well. The lack of sleep and the sleep disturbances that we talked about from the hot flashes and night sweats may also lead to grumpiness. Nobody feels great when we aren't sleeping well, so this can lead to mood changes and ultimately depression as well. Another common complaint is vaginal dryness. This occurs in greater than 50% of women during this age group. Vaginal dryness is due to a decrease in estrogen. The lining of the vagina and the urethra are an estrogen-dependent epithelium. So when we have a lack of estrogen or a decrease in estrogen, these linings become more thin. The thinning leads to dryness, and the dryness leads to the discomfort that we hear. With increased dryness, we also get irritation and sometimes itchiness. With this, we can also have pain during intercourse. Pain during intercourse leads to libido, and that again can cycle back to increased reasons for depression. There are also some long-term consequences of decreased estrogen in a woman. For one, estrogen is an important hormone for the control of bone density. As we start to lose our estrogen, we also lose our bone mass. Studies show that over a 10-year period of perimenopause and menopause, there is approximately a 10% decrease in bone density. With a decrease in bone density, bones become more fragile and you are more likely to have a fracture. This is something that women have to be very cautious of, especially those who are of smaller bone density or of the Caucasian race. Cardiovascular disease is another issue that women suffer through the perimenopausal state. Decrease in estrogen can cause problems with cardiovascular disease. This is thought to be due to the lipid profile. Oftentimes we have increased cholesterol and increased lipids after the decrease in estrogen. The LDL, which is also known as the bad cholesterol, increases by about 6% after menopause. Weight gain and body composition changes are another major concern for women in this age group. This is often because of the decrease in metabolism and the increase of the cholesterol, as we just spoke of. The changes in body metabolism can lead to weight changes or weight gain. This also cycles back to make the depression symptoms more severe. So what do we do about this? As I spoke before, we often hear, I just don't feel well. My periods are irregular, my mood is low, I have hot flashes, and I just don't feel well. As I mentioned before, we do not routinely draw lab work on somebody who is age 40 and has these symptoms, if you are 40 or over. Studies show that the changes in the menstrual bleeding are the most accurate way to determine true menopause. And so here, that is how we diagnose. However, if a patient is younger than age 40 and going through these symptoms, that's when lab work may be important. There could be an underlying hormone issue such as thyroid or parathyroid hormone, and these things can cause symptoms that need to be evaluated. Of course, ruling out a pregnancy is also important, so HCG levels should be done too. So now the important thing to talk about is treatment. How do we feel better from these symptoms? Hormone replacement therapy is a very effective means of treating the symptoms such as hot flashes, vaginal dryness, depression, and mood swings. Although we used to give hormone replacement therapy to most women in this stage, we have since learned that this is not the best idea. The Women's Health Initiative was a large study that took into consideration giving hormone replacement therapy to women in this state. The results found very significant increase in cardiovascular disease. It was shown statistically significant that women had increased risk of heart attack, stroke, and blood clots when they were on hormone replacement therapy after age 60. For this reason, we do not give people hormone replacement therapy after age 60 routinely, and we certainly do not give it to them just for thinning bones or bone loss. So it is still acceptable for women in their 40s to have hormone replacement therapy for the treatment of hot flashes, decreased libido, or mood swings. However, the use of these medicines should be limited to 5 years or less. The ideal is to look at the total risks and benefits and try to go for the lowest effective dose for the least amount of time. This is something you should talk to your provider about if you are considering it. Of course, there are alternatives to treatment, and these are safe for everyone. Ways that we can feel better would be to lead an active lifestyle. Diet and exercise can make people healthier and happier. Exercise has been shown to decrease rates of depression and also mood fluctuations. Eating a diet full of fresh fruits and vegetables will make sure that you have enough vitamins and minerals to give you enough energy as well. These things are safe without the added cardiovascular risk. So in conclusion, if you are a woman in this perimenopausal or postmenopausal state, it is important to talk to your doctor about healthy ways to treat the symptoms of menopause. There are a lot of symptoms that vary, and each case or each patient is different. Healthy lifestyle, though, is safe for everyone and definitely recommended.